World Health Organization raises concerns over the rising number of infections among the youth in the country. WHO says new COVID-19 cases in the Philippines, as well as in Japan and Australia, are coming from the 20 to 40-year-old age bracket. WHO officials consider this age bracket the active group, or those belonging to the working sector. They call them the driving force of the pandemic. They say people in this age group may be transmitting the virus unknowingly, as they're more likely to have mild or no symptoms at all. We now go above and beyond the headlines with health social scientist and UP College of Medicine professor, Dr. Nina Castillo Carandang. Good evening, Dr. Carandang. Thank you for joining us.
Thank you, Ms. Pia. Good evening.
Yes, Dr. Carandang. Like we were saying, no, COVID numbers are highest among young people aged 20 to 40. What does this tell us?
Actually, when I review the numbers, it's the population 20 to 59 who are active, productive working group who have the real population of about 80% of our current cases are found in this working population. And we're now practicing the seesaw approach to COVID-19. So we've seen the hammer or suppression where we have enforced stricter lockdowns. But now we have shifted to mitigation or the dance portion. It's the hammer vis-a-vis the dance. So we're losing up restrictions. And during this time of the dance, we need to learn to protect ourselves. So the bulk of the infections are in the 20 to 59 because these are the people who go to work. They are the people who also run errands because we also want to protect the elderly who are at home and who are more vulnerable. So who are those in the 20 to 59? Well, we have returning overseas workers, usually of the productive age group. We have also locally stranded individuals or the Filipinos that got stuck in Metro Manila during the lockdown in mid-March. And of course, we have locally employed persons. So it's really the age group 20 to 59, which currently accounts for 80% of the COVID infections we have in the country, Ms. Pia.
Okay, and doctor, in other words, there's really nothing we can do about it because, like you said, these are the people who go out to work. These are the people who run errands. So it's not as if we can make them stay home so that they can't transmit the virus. In other words, the only thing we can really do is um, uh, be very disciplined. Have everyone be very, very disciplined.
That's
Ganun ba,
true. We
doctor?
need more discipline, but we could also enforce better standards. For example, transportation standards before the timeout, which were called by my healthcare professional colleagues, have not yet been fully implemented. Hopefully, they will be fully implemented soon. There are workplace-related factors too, Ms. Pia. So the minimum health standards in the workplace are not fully implemented. Then for companies or businesses where there's a no work, no pay policy, such also like in government agencies, there comes a point where there is presenteeism. The employee prefers to attend to work rather than be without pay, even if he or she is sick because of the restrictive leave policies and the loss of income. There's also the possibility of improvements in access to care, especially for testing, because testing is still problematic. It's difficult in many areas, and those who are old are not tested anymore. The younger people are also braver to go out, and some of them think that they are not vulnerable. So oftentimes they don't pay attention to the mild symptoms which they may be experiencing and just brush it off. So aside from discipline, there has to be greater self-awareness, stricter implementation of various workplace standards, transportation standards, expanded access to care and to testing, and also for a quicker turnaround time for those who do have the test.
So there's a lot that we need to do because we can't, like we were saying earlier, no, we can't keep people home, especially all these young people who need to go to work. At the same time, ma'am, about a month ago, there were quite a bit of uh, reports, no, from abroad because in some countries, when they would begin to ease lockdown restrictions, many of the young people would go and party. uh, pupunta sa mga bars, halimbawa. These are in
Mhm.
other countries. So, um, can we talk about that kind of behavior? Because young people naturally always want to interact. And
Yes.
so, tama po ba yung iniisip ko na virtual interaction, of course, is the alternative, but sometimes that may not be a very good replacement for human, physical, social interaction. So how do we understand this, and how do we keep this in mind while we try to keep the numbers low?
Okay. There are tensions inherent in our current situation, especially for the younger people. There's a tension of isolation. There's a tension also of the need for
Right.
relevance. There's also the tension due to unemployment, and there's a tension of relationships. As isolation becomes more rampant, there's, of course, like you said, an irrepressible biological and emotional need to connect, whether it be virtually or not. My son, who's currently based in Singapore, said that the Singapore government has learned to realize this, and then as time goes on, they are allowing more and more freedoms slowly to try to reduce the isolation. And this
Mm.
part is really the dancing with the virus. The isolation is a public health crisis
Right.
because when you're young, these are your formative years for building your self identity. And it's hard to build self identity purely by digital means or without actual people to talk to, the society, family, and friends. In 1902, a sociologist named Charles Horton Cooley had the concept of the looking glass self, where we measure how we're doing or how badly or how well we're doing against the views of others. And in the digital world, that isn't always possible, and sometimes it's even harmful. The absence of these mirrors and feedback mechanism will likely cause further self-esteem and further self-isolation. The other tension I mentioned was that of the need for
Mhm.
relevance. If you remember how it is to be young, you wanted to be heard, you wanted to explore. So the need to be
Yes.
relevant is so important for the younger age group because it affects self-esteem. And the lack of self-esteem can also further contribute to the feeling of walang pag-asa. Where do I go from here? It's good if you have
Mhm.
family, friends, or your faith to dig into. But if you don't have deep psychosocial, emotional, and spiritual reserves to dig into, it's really hard. The other tension, of course, is unemployment. And it's a given
Mhm.
that really, if people are hungry, they will go out and find a means to earn a living. My guess is that this current generation will probably not have the same access to education as we did or the same access to employment
Mhm.
opportunities. Therefore, they might end up to be poorer in the future than what we had ever imagined. The other tension I mentioned is relationships. They have become very fragile. So
Mhm.
you have people now who are single and alone, and they're craving for connection and love, but unable to do so because of the lockdown. Then the second
Mhm.
group is you have your
Right.
locked apart lovers, people who are apart from each other and don't really have a chance to be physically together. Of course, many Filipinos are familiar with this because we have many overseas Filipinos. So, real
Long distance
sexual
relationship.
intimacy, for example, it becomes threatening. And I'm very worried, Miss Pia, also about couples who are locked down and the effect also on the
Mm.
number of cases of domestic violence or also the number of new babies we
Mhm.
will have
Yes.
in the future.
Right. Right. Wow. This is a real full-blown crisis, health crisis also, mental health crisis, and everything in between, social health crisis. Dr. Nina Castillo Carandang, thank you so much for sharing with us your perspective. Salamat po, ma'am.